Well, tonight's 5:30 Focus, you are what you eat. That phrase coined nearly 200 years ago, but it's really never been more relevant.
Growing research shows Americans' health is directly linked to our lifestyle, and doctors acknowledge a direct link between diet and chronic disease. That is today's 5:30 Focus.
Yeah, later in this report, we're going to be hearing more about the growing debate over fluoride in our drinking water, widely adopted to strengthen teeth and reduce cavities. Some studies now suggest that high levels of fluoride exposure may be linked to health issues, even lower IQs in our children. But first, let's talk about food.
With RFK Jr. now leading the Department of Health and Human Services, many expect significant changes in U.S. health policy. In this special I-Team report, from pharmaceuticals to food additives, companies that manufacture things we put in our bodies are on notice. There's a new sheriff in town. In this special I-Team report, again, we're going to be looking at things we put in our bodies. Jim?
Yeah, and Liz, the numbers really are startling. 72% of American adults are either obese or overweight, and those extra pounds are the single biggest reason most Americans are taking at least one prescription medication every day. Half of those are drugs for cardiovascular disease. Turns out that is the single biggest killer in the U.S., and now, thanks in part to RFK Jr., we're about to take a hard look at what's in the food we eat.
Remember the food pyramid? The U.S. Department of Agriculture now calls its dietary guidelines MyPlate, but not much has changed. MyPlate recommends a low-fat diet with lots of vegetables, fruits, grains, dairy, and lean protein. But with more Americans than ever struggling with weight and sickness, is it time to re-examine those rules?
The problem is, in the 21st century, we're now facing literally a tsunami of so-called chronic diseases that, while they were present in the last century, they're now in literally biblical proportions.
Author and speaker Dr. Robert Lovkin says we're making ourselves sick by the things we're eating.
The one thing we can recommend for everybody is to decrease what are called junk foods or highly processed foods. Now, these foods typically have high carbohydrates. They have, a lot of sugar. They have a lot of high fructose corn syrup. They also have a lot of ultra-processed seed oils, which are harmful also. And they usually have a lot of grains.
One study estimates Americans get more than 50% of their daily calories from ultra-processed foods, and an alarming 73% of our food supply is considered ultra-processed. One way to avoid eating these foods is by checking the ingredients. In the fine print, look for things like sulfites, a preservative that can cause allergic reactions. Nitrates used in processed meats have been linked to an increased risk of cancer. Trans fats from hydrogenated oils are now believed to cause heart disease. And polysorbates, those are commonly used in ice cream, baked goods, cottage cheese, even pickles, to stabilize and emulsify the foods. However, they can disrupt the gut microbiome, leading to metabolic and inflammatory diseases.
You can really trace most of our chronic diseases in this country to a fundamental metabolic problem and inflammation. And a lot of that really comes from putting the wrong foods in our bodies.
Dr. Jessica Chin is among a growing number of doctors who work to educate their patients on healthy eating. She says it's not just our diet that's a problem. The meat from cattle that eat corn and grain in feedlots is very different from those that graze on grass, leaves, and wildflowers.
The steak that's produced in the U.S. that's grain-fed has no omega-3s. Steak, how it used to be 60, 70 years ago, or in a lot of other countries where it's still grass-fed, actually has omega-3 fatty acids. Most people don't realize that just the quality of the meat that we eat is so critical based on how the animals were raised.
So where do we start? Dr. Chen recommends shopping for fresh whole foods, grass-fed meat, and pastured dairy.
I think we're really starting to see a shift because people are starting to get some of those chronic conditions and realize, hey, if I'm in my 40s and I've already had a heart attack or I already have diabetes, this isn't how I want to live the rest of my life.
For the first time, we're hearing on a national level politicians talking about chronic disease and seed oils and grains and junk food. Hopefully this will not be a political issue, and we'll see both parties embrace this because it's really for everybody.